The first electrolyte we're going to talk about is sodium. The normal range for sodium is 135 to 145. Sodium affects our nerve conduction, muscle function, and body heat. So when we're talking about the signs and symptoms, think about these three topics. So first, hyponatremia. That is when your sodium is abnormally low. This is caused by hypovolemia, diuretics, vomiting and diarrhea, diaphoresis, water intoxication, IV hypotonic fluids. Keep in mind, when we're losing a lot of fluid, it pulls out a lot of electrolytes. So diuretics, when we pee a lot, we lose a lot of electrolytes. Vomiting and diarrhea, we're losing a lot of electrolytes. So think about it in that way. Signs and symptoms for hyponatremia is lethargic, confused, weakness, muscle cramps, seizures, anorexia, nausea, vomiting, low serum osmolality. The words that are highlighted are the ones that tie into the functions that it affects. So when you're trying to study for this, remember the functions and connect those, and then all you have to remember are the black words. Okay, hypernatremia is high sodium levels. This is caused by excessive intake of sodium, IV hypertonic fluids, so the opposite that it was for hyponatremia, loss of water due to diarrhea, inadequate intake of water, loss of water due to fever. The signs and symptoms for hypernatremia is thirst, dry and sticky mucous membranes, weakness, elevated temp, confusion, irritability, decreased level of consciousness, hallucinations, seizures, and high serum osmolality. Example foods that have a lot of sodium. Think of your salty foods. So chips, processed meats, cheeses, cereal. Things in cans are stored with a lot of salt. So any canned veggies, canned soups, things that have to be preserved for a long time have a lot of salt in them. And then of course table salt.
The next electrolyte we're going to talk about is chloride, or Cl. The normal range for chloride is 98 to 106. The function of chloride is it helps us form stomach acid, or hydrochloric acid, and it helps with our acid-base balance throughout the body. And overall, it just is kind of a buddy that helps sodium. Remember that sodium assists our nerve function and our muscle function, so chloride does as well. Abnormally low chloride is called hypochloremia. This can be caused by overhydration. If we have too much water, it's going to dilute our chloride levels and make them low. Also, heart failure and kidney issues cause us to hold on to a lot of fluid. So again, it dilutes our chloride and makes it low. Anytime we have vomiting or gastric suction, we remove a lot of our electrolytes with that. So we're removing chloride as well. Burns as well will cause us to release a lot of electrolytes because our skin can't hold them in. And chloride is one of those. There's also some medications that can affect this, such as bicarbs, steroids, and diuretics. So when you have a low chloride level, it causes irritable nerves and irritable muscles, which makes sense because chloride affects those things because it helps sodium. It also causes something called tetany, which is when you have really stiff muscles that you can't relax, hypotension, and shallow breathing. Abnormally high chloride levels are called hyperchloremia. That can be caused by dehydration. Now, instead of having excess fluid, I've lost a lot of fluid. So chloride is in a higher concentration. It's not diluted by water, so we have high levels in the bloodstream. Excessive normal saline can cause this, the IV fluid normal saline, anemia, again, kidney issues, and hyperventilation. So signs and symptoms of having a high chloride level includes weakness. Again, remember chloride affects our muscles. Lethargy. Remember it affects our nerves. And deep breathing. Example foods include green leafy vegetables and seafood, whole grains, table salt also, because remember salt and chloride are kind of buddies, tomatoes, and olives.
The next electrolyte we're going to talk about is potassium. Potassium's normal range is 3.5 to 5. The functions that potassium helps with is nerve conduction, muscle function, and protein synthesis. So abnormally low potassium is called hypokalemia. This is caused by vomiting, gastric suction, diarrhea, laxatives, enema, diuretics, anorexia, and alcoholism. You may have noticed that a lot of these causes are very similar to the previous ones. That's because it's very common to lose a lot of electrolytes when we're losing a lot of fluid. So that goes with the vomiting, the gastric suction, diarrhea, laxatives cause diarrhea, enemas do, diuretics getting a lot of urine out, anorexia not replacing those electrolytes. This all kind of makes sense. So the signs and symptoms that can go with hypokalemia is weak, irregular pulse, fatigue, nausea, vomiting, muscle cramping, decreased peristalsis, and paresthesia. Think about the muscles and the heart being a muscle. When I think of potassium, I think of dysrhythmias. Well, when we're looking at our signs and symptoms, we see irregular pulse, muscle cramping. Well, the heart is a muscle, so it makes sense that potassium is going to affect the heart when we don't have enough of it. Okay, so now to hyperkalemia, abnormally high. That is caused by renal failure, traumas and crush injuries, burns, hemolysis, IV potassium, potassium-sparing diuretics, and DKA. So when we're looking at these, when you see IV potassium and potassium-sparing diuretics, we have medications that are diuretics but specifically don't take the potassium out and excrete it through the urine. So it would make sense that our potassium would get higher with that one. The signs and symptoms that come with hyperkalemia is anxiety, irritability, confusion, irregular pulse again, so having too much potassium can still affect those muscles, aka the heart, bradycardia, muscle weakness, paresthesia, and abdominal cramping. Foods that have potassium, I know that we often think of bananas, but there are many other foods that have high potassium. So fish, potatoes with skin, nuts, broccoli, and citrus fruits.
The next electrolyte is calcium, abbreviated Ca. The normal range is 9 to 10.5. The function of calcium is that it's a component of our bones and teeth, which is what we usually think of when we hear calcium, right? Bone strength. But it also contributes to our blood clotting, nerve conduction, and heart contraction. So we'll see how this affects our nerves and our heart and bleeding as well. Abnormally low calcium is called hypocalcemia. Calcium is produced in turn because of a release of hormones by the parathyroid. So whenever we have a low function of that gland, we're also going to have a low production of calcium or a low ability to retain calcium. So that can cause us to have some calcium issues if that gland isn't working correctly. Also, pancreatitis can lower our levels. Vitamin D deficiency, because vitamin D helps us absorb calcium and retain it. Inadequate intake in general, if we're not eating enough calcium or taking it in. Hyperphosphatemia. Well, that means a high level of phosphate. We're going to talk about that next, but calcium and phosphate are opposites. So whenever calcium's low, phosphate's going to be high, and vice versa. Alcoholism can also cause low levels. So signs and symptoms for hypocalcemia. Remember, this affects your nerves, so we're going to see confusion and anxiety, also numbness and tingling. Remember, it affects our muscles, so we're going to see muscle cramps and that tetany, those really tense muscles that won't relax. Our neurofunction can cause seizures, hyperactive reflexes, where our reflexes respond really strongly. Irregular heart rate, again, the heart's a muscle and it affects our muscles. There's also special signs, Schwastek and Trousseau signs. Those are something that we see with low calcium levels because of the effect on our nerves. So the Schwastek sign is when you tap the cheek. It causes like a tremor. It almost looks like a tick because of the nerve response. Okay, hypercalcemia is the term for high calcium. Again, our calcium levels are kind of linked to that parathyroid gland. So when that gland is hyperactive, we're going to have high levels of calcium. Also, if we have prolonged bed rest or bone malignancy, like a tumor in the bone, and osteoporosis. Osteoporosis is the breakdown of bones, so calcium is released into our bloodstream and we have high levels. Signs and symptoms are lethargic, coma, decreased muscle strength, nausea and vomiting, constipation, fractures, an irregular heart rate, and kidney stones. Some example foods would be milk, of course, and cheese, ice cream, yogurt, those dairy products that we think of. We also see it in some leafy greens and tofu.
The next electrolyte we're going to look at is phosphate. The normal range for phosphate is 3 to 4.5. So think as of phosphate and calcium as kind of opposites of each other. So they're opposite of buddies. They kind of are, they do opposite things. So phosphate's function is helping maintain bone and teeth and carbohydrate metabolism. We know that these are very similar functions to calcium. Think of it in a way that if calcium is really high, we don't need as much phosphate, so it's low. If phosphate is really high, we don't need as much calcium, so it's low. So they almost work against each other when they're really having similar functions. So abnormally low phosphate is hypophosphatemia. This is caused by hyperventilation, hyperglycemia, antacids, starvation, inadequate vitamin D, chronic diarrhea, diuretics, and hyperparathyroidism. The signs and symptoms with hypophosphatemia is weak pulse, shallow respirations, hypotension, decreased cardiac output, anemia, bleeding, bruising, decreased reflexes, and risk for infection. When we have low phosphate, we have trouble breaking down carbohydrates, right? That's in our functions. So we're weaker, we're more tired, we don't have any energy. So our pulses are weak, we have shallow respirations. All of this connects and it makes sense. Abnormally high phosphate is hyperphosphatemia. This is caused by impaired kidney function, acid-base imbalances, cell injury, and hypoparathyroidism. Hyperphosphatemia's signs and symptoms are tetany, hyperactive reflexes, muscle spasms, fast and irregular heart rate, and nausea and diarrhea. So these are similar side effects of calcium because they do similar things. So that makes sense. And then also, that it's opposite of calcium, inverse relationship. We've discussed that. Foods that have high phosphate is meat, legumes, nuts, milk, and whole grains.
Okay, finally we have the electrolyte magnesium, or Mg. The normal range is 1.5 to 2.5. Magnesium helps cells function and create protein. They also help maintain optimal calcium levels. And remember that calcium affects the nerves and the heart muscle. Think of magnesium as something that relaxes smooth muscle. So when it's present, we're able to relax. So when we have abnormally low magnesium, it's called hypomagnesemia. This can be caused by decreased intake, we're not getting enough through our diet, or decreased absorption. We have a problem with our gut where we're not absorbing magnesium, so we have low levels. Also, when we have NG suction, or we're suctioning out gastric contents, we lose magnesium. Prolonged diarrhea, ulcerative colitis, and Crohn's disease, which has to do with the gut, and diuretics. When our magnesium gets low, remember that magnesium relaxes muscle. So when we have low levels, our muscles get really tense and tight. They're unable to relax. So we have irritable nerves, irritable muscles, we have hyperactive reflexes, we have seizures, our heart rate is fast and irregular. It also affects our nerve conduction, our nerves in the brain, so we can see hallucinations with it as well. Additionally, you might see dysphagia or trouble swallowing and nausea vomiting. Hypermagnesemia is for abnormally high magnesium. That could be excessive intake of antacids because antacids a lot of times contain magnesium. So if we take too many, our levels can get high. Sometimes we use IV magnesium to treat certain conditions like preeclampsia or asthma, renal failure, dehydration, adrenal problems, issues with the adrenal gland, and leukemia. When our levels are too high, then remember now we're too relaxed. That relaxing effect is almost too much. So we get warm and flushed, we have nausea and vomiting, but also this lethargy, muscle weakness. Now our reflexes are decreased. We have hypotension, our heart is too relaxed, right? Slow and irregular heart rate and slow respirations. So it's almost too effective at relaxing those muscles. Example foods include bok choy, tofu, cashews, and dried fruits.